BPH in older men, managing symptoms and maintaining health. Understanding benign prostatic hyperplasia, BPH. Benign prostatic hyperplasia, BPH, is a common condition that affects men as they age. It refers to the enlargement of the prostate gland, which is located just below the bladder and surrounds the urethra. This enlargement can result in various urinary symptoms and can have a significant impact on a man's quality of life. The exact cause of BPH is still not fully understood, but it is believed to be related to hormonal changes that occur with age. As men get older, the levels of testosterone, the male sex hormone, decline while the levels of estrogen, the female sex hormone, increase. This hormonal imbalance is thought to contribute to the growth of prostate tissue, leading to the enlargement of the gland. Other factors such as genetics and lifestyle choices may also play a role in the development of BPH. The prevalence of BPH in older men. BPH, or benign prostatic hyperplasia, is a common condition that affects older men. As men age, the prostate gland tends to grow in size, causing various urinary symptoms. It is estimated that the prevalence of BPH increases with age, with studies suggesting that up to 90% of men over the age of 80 may have some degree of prostate enlargement. Although BPH is not a life-threatening condition, its impact on quality of life cannot be ignored. The exact causes of BPH are not fully understood, but factors such as age, family history, and hormonal imbalances are believed to play a role in its development. Understanding the prevalence of BPH in older men is crucial for healthcare professionals to provide appropriate care and management strategies. By recognizing the commonality of this condition, medical institutions and support networks can work towards raising awareness and implementing effective treatment options. With an increasing aging population, addressing the prevalence of BPH in older men becomes even more significant in promoting overall health and well-being. Risk factors for developing BPH. There are several risk factors that may increase the likelihood of developing BPH in older men. Age is one of the main risk factors, as BPH is more prevalent in men over the age of 50. As men get older, the prostate gland naturally grows and can lead to BPH. Hormonal changes also play a role in the development of benign prostatic hyperplasia. Specifically, the increase in levels of dihydrotestosterone, a hormone that promotes prostate growth. Furthermore, genetics may play a role, as men with a family history of BPH are more likely to develop the condition. Lifestyle factors can also impact the risk of developing BPH. Obesity has been linked to an increased risk of BPH, as excess body fat can lead to hormonal imbalances and inflammation. Additionally, a lack of physical activity has been associated with a higher incidence of BPH. Sedentary behavior may contribute to weight gain and hormonal changes, potentially increasing the risk of developing BPH. Finally, certain medical conditions such as diabetes and heart disease have been found to be associated with an increased risk of BPH. Understanding these risk factors can help individuals take proactive steps in managing their health and potentially reducing their risk of developing BPH. Recognizing the symptoms of BPH. As men age, it is important to be aware of the symptoms that may indicate the presence of benign prostatic hyperplasia, BPH, a common condition affecting the prostate gland. One of the key symptoms to look out for is difficulty in starting or stopping urination. Men with BPH may experience a weakened urine flow or a need to strain during urination. In addition, frequent urination, especially during the night, can be a telltale sign of BPH. These symptoms arise due to the enlargement of the prostate, which can obstruct the flow of the urine and result in urinary problems. It is important to recognize these symptoms early on to seek appropriate medical attention and ensure timely management of BPH. Another symptom to be mindful of is the feeling of incomplete bladder emptying. Men with BPH may experience the sensation that their bladder is not fully emptied even after urination. This can be accompanied by a persistent urge to urinate despite just having done so. Additionally, BPH can lead to urinary retention, wherein the individual is unable to empty their bladder completely, resulting in discomfort and potential complications. By recognizing these symptoms, men can take proactive steps towards addressing and managing BPH effectively, improving their overall quality of life. The impact of BPH on quality of life. Benign prostatic hyperplasia is a common condition that affects prostate gland in older men. As the prostate enlarges, it can start to press against the urethra, leading to a range of symptoms that can significantly impact a man's quality of life. One of the primary effects of BPH is urinary dysfunction, which can manifest as frequent urination. Urgency to urinate, weak urine flow, and incomplete emptying of the bladder. These urinary symptoms can be distressing and disruptive, affecting various aspects of a man's daily life. Sleep disturbances often occur as a result of the need to wake up multiple times during the night to urinate, leaving individuals feeling tired and fatigued throughout the day. Moreover, the constant urgency to find a bathroom can lead to feelings of anxiety and embarrassment, causing some men to restrict their activities and social interactions. Additionally, the persistent feeling of incomplete bladder emptying can lead to a reduced sense of well-being and satisfaction. Overall, the impact of BPH on quality of life is significant and should not be overlooked. Diagnostic procedures for BPH. When it comes to the diagnosis of BPH, healthcare professionals rely on several diagnostic procedures to accurately evaluate the condition. These procedures are essential in determining the severity and extent of prostate enlargement, as well as ruling out other potential underlying causes of urinary symptoms. One of the common diagnostic procedures for BPH is the digital rectal exam, DRE. During this procedure, a healthcare provider inserts a gloved, lubricated finger into the rectum to feel the prostate gland. By assessing the size, shape, and texture of the prostate, the healthcare provider can make initial observations about the presence of BPH. Although the DRE is a simple and non-invasive procedure, it provides valuable insights to guide further diagnostic steps. Another diagnostic procedure commonly employed for BPH is the prostatic specific antigen PSA blood test. PSA is a protein produced by the prostate gland, and elevated levels of this protein can indicate the presence of BPH or other prostate conditions, including prostate cancer. While the PSA test alone cannot diagnose BPH, it serves as a useful tool in combination with other diagnostic procedures. A healthcare provider will analyze the PSA levels in the blood, taking into consideration the patient's age and other factors, to help determine the need for further evaluation and potential treatment options. Treatment options for BPH. There are several treatment options available for men with benign prostatic hyperplasia, BPH. Depending on the severity of symptoms and individual patient preferences, one common approach is medication therapy, which aims to manage BPH symptoms and reduce the size of the prostate gland. Alpha blockers such as terazosin and tamsulosin work by relaxing the muscles in the prostate and bladder neck, improving urine flow and reducing urinary symptoms. Another class of medications called 5-alpha reductase inhibitors, like finasteride and dutasteride, can help shrink the prostate gland over time. These medications are often used in combination to achieve optimal results. However, it is important to note that medication therapy may only provide temporary relief, and its effectiveness can vary from person to person. For individuals with more severe BPH symptoms or those who do not respond well to medication, surgical interventions may be recommended. Transurethral resection of the prostate is a common surgical procedure where excess prostate tissue is removed using a thin tube inserted through the urethra. This procedure is highly effective in relieving urinary symptoms but may require a hospital stay and have associated risks and complications. Other surgical options include laser therapy, transurethral incision of the prostate, and prostate artery embolization (PAE). It is crucial for patients to discuss the potential benefits and risks of each surgical option with their healthcare provider to determine the most suitable treatment approach for their specific situation. Medications for managing BPH symptoms. There are several medications available for managing the symptoms of benign prostatic hyperplasia, BPH. These medications work in different ways to alleviate urinary symptoms associated with BPH and can be prescribed by a healthcare professional. Alpha blockers are commonly used to relax the smooth muscles in the prostate and bladder neck, making it easier for urine to flow. They can provide quick relief from urinary symptoms such as frequent urination, urgency, and weak urine flow. Some commonly prescribed alpha blockers include tamsulosin and terazosin. It is important to note that these medications may cause side effects, such as dizziness and low blood pressure, especially when starting the treatment. Another type of medication used to manage BPH symptoms is 5-alpha reductase inhibitors. These medications work by blocking the conversion of testosterone to dihydrotestosterone DHT, a hormone that contributes to prostate growth. By reducing DHT levels, these medications can help shrink the prostate gland, improve urinary symptoms, and reduce the risk of complications. Finasteride and dutasteride are common examples of 5-alpha reductase inhibitors used for BPH treatments. It is essential to discuss the potential side effects, including sexual dysfunctions, as well as the benefits of these medications with the healthcare provider before starting treatment. Lifestyle modifications to alleviate BPH symptoms. Men who are experiencing symptoms of benign prostatic hyperplasia (BPH) often find relief through specific lifestyle modifications. Making these changes can help alleviate symptoms and improve overall quality of life. One important lifestyle modification is maintaining a healthy weight. Obesity and excess body weight can contribute to the severity of BPH symptoms. So, adopting a balanced diet and engaging in regular physical activity can be beneficial.